before, I'd go to my regular primary doctor's office and I would be ecstatic if I only had to sit in the waiting room for 20 minutes, but it generally was half hour, sometimes 40 minutes. Then you would get taken back to your exam room, and I felt like you were sitting there even longer. Then when the doctor did come in, I felt as though you were super rushed because obviously they were behind on their patients for the day because it's now 45 minutes past your scheduled appointment time. I had heard a lot of good things about the local doctor, Dr. Power here at WeCare, about how he took the time to talk to his patients. You didn't feel like you were rushed when you came in to see him. And I noticed that it started to become that way with my previous primary care physician. And I said, you know what, I'm going to give it a try. I want to see if there's any difference between the two of them. And there was a huge difference. You never feel rushed when you come into the office. He explains everything to you in layman's terms. So if you're not medically savvy, he will tell you in just a layman term what it is that he's thinking, what it is that he sees. You don't feel like you have to keep like looking at the clock saying, oh my gosh, I'm like 15 minutes past the time that I should be here, but he's still talking to me. I mean, he's amazing. My husband, who is a police lieutenant, men generally don't like to go to the doctor, and took some convincing. And I said, you just have to go see Dr. Power. He's amazing. I think you're really going to like him. And he came in for his first initial appointment, and he came home that night and he said, I really do not like going to the doctor, but he's very cool. I feel comfortable with him. I feel like he explains everything that I need to hear. And I would suggest him to anybody. I would go to the doctor maybe once a year for a physical. Very rarely did I have lab work done because I just dreaded going, because I felt as though every time I went to a doctor, it was, here's some medicine, take this medicine, take this medicine. I am 100% not a medicine person, but the care that you get here is totally different than the care that I received ever in my entire 51 years. I can call them, and they know that I don't call unless I generally, I really, really need to go see the doctor. But when I do get to the point where I feel like, okay, something's not right, Motrin's not cutting it, I can call them, tell them my symptoms, and they get me in within the day. I love that. I love the convenience of it. It's very close to my office, but even for my husband, it's very convenient for him as well. Their lab is amazing. You can stop in, if you have lab work assigned to you, you can stop in the morning, have your lab work done. They can call you and give you the results. It is very convenient. It's not like your typical primary care physician's office where you possibly have strep throat and it takes 2 weeks to get in to see them. So I don't have to sit in the waiting room here. I usually walk in and they open the door and say, you can come on back, Carrie. You get in, you don't feel rushed. The doctor or the nurse practitioner will take all the time they need with you. They don't try to cram a bunch of patients in at the same time, which I think is part of the problem with the, outside medical care. They space it out a little bit, so they do have the opportunity to answer questions and talk to patients and make them not feel rushed. I cannot say enough about this place.